saw on Facebook, I follow a lot of rescues and people that work in the animal world, and there was a particular woman who has a dog that she found out tore its I guess the equivalent of the ACL
Right.
in the human,
Right.
and was concerned that she was going to be looking looking at surgery for this dog. And it was so funny because I started to type, look into rehab options, Dr. Randy, and all of a sudden it just started popping up. Everyone's going, have you seen Dr. Randy? Did you go see Dr. Randy? There's options, there's things you can do, without jumping right into surgery that can help. And so it was pretty cool to see all these people.
Yeah. It's, the nice thing is I think, and the ability that Hillary and I have through our show is to make sure people know that there are all types of things going on out there. And that's really one situation which, seriously, on a weekly basis, we probably see 3 to 5 new cases of partial or complete tears of the cranial cruciate ligament or the anterior cruciate ligament in dogs. It's becoming, in some breeds, a real genetic problem. I mean, we see it in Rottweilers and Rottweilers and Dobermans that they must have some genetic laxity because these things are tearing right and left, and we do have an option for rehabilitation. It's not always there are lots of options out there. So obviously there's surgery, and in that surgery there's what we call TPLO or TTA or tightrope. There's 3 different surgeries that can be done. In smaller dogs, there's also a repair called an extracapsular repair, and it's great to have those legs stabilized and give them a stable outcome, but it's also very difficult because in a lot of surgical venues they talk about 6 to 8 weeks at least, and sometimes 6 to 8 months of being off of that leg, not doing anything, which is not true. And I mean, they need to be starting in rehab and water therapy really within 10 to 14 days after that happens. And so it's the expense of the surgery, it's the time off for the surgery, it's the muscle mass loss of the surgery. And, again, not to say that these things don't work, because they do, but not every animal has to have that.
Right.
And a good friend of mine just called me, and she's a wonderful lady. She was on the city council here in Tucson, and she has a dog that has a partial tear in one leg and a complete tear in the other. And she said, I just don't really know what to do. And I said, well, have you thought about trying to do rehab on this dog first, see how the dog does? You can always go to surgery if you feel like the outcome's not where you want it to be. So she says, well, what's involved? And I said, this is about an hour discussion, but to make it short, we talk about supplements, we talk about food therapy for these animals, we talk about acupuncture and aquapuncture for them, the herbal supplement called Adequin, which we use, laser, underwater treadmill, so they're pulse signal magnetic therapy, all the things we've talked about on this show before. And she said, okay, my head's spinning, I'm coming to see you. So, and I'm happy about that, because if there's something we can do to help that animal, it'll be phenomenal. And we enjoy being in that position, obviously.
There are some braces out there where you would have to somehow make a cast, I believe, so that it's really fitted to your animal. And they'll run anywhere from, probably like $400 to $700, I believe. Now, how helpful are those in that case, or do those just, again, cause more atrophy? Or is in that situation where there's a partial and a full tear in the other leg, is that something where you would look to use it so that one leg can repair?
Well, there's a lot of debate over these braces. There's a very good company called OrthoPets that makes this brace. The problem is this: without any rehabilitation going on, what happens when you brace a injured limb is, one, you never really get that limb a chance to start to build up its muscle mass to recover. We've got the joint that's damaged, but we have muscle all around that joint, and that's what protects our limbs. That's what protects our joints. And so when you put a brace like this on, one, you've taken the weight off of that leg completely, and so now you have no ability to repair. But even bigger, the problem is the effect on the other leg or the other legs. Dogs and cats have 60% of their weight on their front legs, 40% on their back. So if you start taking the weight off of that one limb, you're putting that extra weight on the good leg or partially torn leg, or you're making that all that pressure go forward, and so you're affecting the spine and the front legs. So, for example, I've talked about this on the radio before, we had a very sad case of these young kids that had a beautiful Staffordshire pit bull who ruptured his right cruciate. and they went and sought help to get one of these braces made. They spent almost $800 to have the brace made for the dog. They put it on the dog's bad leg, and within a week, the good leg tore.
Oh.
So they had a cruciate rupture now in both legs. And the animal was actually brought to us for euthanasia. And we refused to do that. We said, look, if you can't afford this animal, if you give the animal up for adoption, we'll rehab this animal, we'll fix the leg that we have to if we have to, and we'll get this animal adopted out. And that dog's doing beautifully, had rehab, actually had surgery on one of the legs to stabilize the joint, and you can't even tell that it's had a problem. And it's alive, which is even better.
I haven't yet talked about this really to anyone, but I am a certified.
Including me?
Yeah, well, I mentioned it to you the other day that I am a certified personal trainer.
Yes, that's right. You did say that.
And we tend to, in our human bodies, you have one leg that's, I guess if you think about playing basketball, you have one leg that you would normally plant, and then you have one that you would use to push off of.
Right.
And so because of that, you'll have one leg that in the humans that is better at strength, and then one that's better at stabilization, because you have all these smaller muscles that you are using in different types of exercises. And my point being that when you use things like instability balls, Bosu balls, little discs, things that cause instability that would make your body kind of wobble, you're then using all those smaller muscles around the joint and engaging them.
Absolutely.
People wonder why, if someone who does yoga has this nice, long, lean body, because in order to hold a pose, you engage smaller muscles you might not use a lot of the time if you're always using the big ones.
Right.
And so that's something that I believe your rehab then does, is let's build up these smaller muscles so that we can kind of give some of these other areas a break.
Well, that's exactly it. And personal training and physical therapy in the human world is totally equal to the rehab that we do in veterinary medicine. You know, it's called rehabilitation in veterinary medicine because the physical therapist didn't let us use physical therapy. So that's the truth. And the good news about rehabilitation in veterinary medicine is that it's open to physical therapists, veterinary technicians, certified veterinary technicians, and veterinarians. So it really pulls all of those people together to try to do these. So, but you're absolutely right. I mean, we use Bosu balls, we use balancing discs, we use those donuts, the big therapy balls, because on a lot of our animals, we're looking at exactly what you said, those small muscles and the neurologic component to those, the nerve components to those muscles, to stabilize the joint, to help them come back. So it's a very, people say, they're going to put the dog in water and that's how they're going to get it well. Rehab in veterinary medicine isn't equal to underwater treadmill. It's one of the tools that we have, but we do so many things. And we've had hundreds of dogs with partially torn cruciates that are walking around today doing great and never have had surgery. And again, I'm not against surgery. If someone says, I want to have the surgery, but get a hold of us after the surgery and let us get that rehab done. And this is the thing that I tell people is, you wouldn't have in our world any surgery done in any joint and not start physical therapy like the moment you start to wake up.
Right. And you also wouldn't look for every possibility. You don't just go in and say, oh, my knee hurts, and then they say, oh, you should get surgery. Okay.
Right.
You're going to research, you're going to Google, you're going to figure things out.
Right.
You got to take time off work. So you've got to, I think, look into all of those things also, because financially, as opposed to basically getting, whether you get the TPLO, which I guess, is that a complete, there's a difference between TTA and TPLO, and I'm not familiar with what the difference is.
Well, both surgeries look to reconfigure the knee angle so that the angle is such that the problem with the tear of the cruciate ligament is the femur, the top bone. I'm getting technical, but I'm going to dumb this down, I promise. The femur.
Oh my gosh, you just called me dumb.
No, not at all. I'm talking about talking in not using medical terms, which I really try not to do, as you know.
I need a stick figure picture to go with your speech.
Well, this is where our B-roll would have been very helpful, and we're working on that. So the femur, which is the bone that comes off of our hip, sits on top of the tibia and fibula, and the cruciate ligaments are in between those joints. And what they function to do is, as your leg bends, the femur doesn't move forward over the tibia and fibula. It's a hinge joint,
Right.
and your kneecap slides up and down. You got that so far?
I have got that.
Okay, good.
I'm seeing in my head.
Good.
The thigh bone's connected
Yeah.
to the knee bone.
Exactly. You sing so beautifully. So anyway, what you're trying to do with the TTA and the TPLO is reconfigure that joint so that there isn't that what they call drawer sign or movement of the femur over the tibia and fibula. And it does it differently. The TPLO, they're both bone breaking procedures. That's what some people really have a problem with because you have to break the bone to put a specialized plate in to get that angle reconfigured.
Okay.
And both of them do that in different ways. And don't ask me the technical part of that because I don't do either of those surgeries.
Right.
But I've looked at a lot of them. So so I mean, they're advanced surgeries. They're new to our world. When I came out of veterinary school, and that was back before the light bulb, basically.
Right. It was tough to do surgery with a candle.
It really was. We had one of those minor headlamps, and it was really neat. But you got to be careful with the headlamp because we used ether, so it could explode with that flame.
I thought you were going to say because you had a little candle for your headlamp, and you could drip the wax into the cavity.
Well, yeah, that too.
Okay.
Anyway, getting back to thank you so much. I'm not that old. So anyway, when we did the surgery, there was really one technique, and that was what's called a Patsama technique, which took the outside part of the muscle, it's called the fascia, a really tough part of the muscle, ran it through the knee, through a hole, and it got tightened up, and it actually acted like a cruciate ligament. So it was it used the same animal's, muscle, basically, and it really worked very well.
You know what that's like? And this is going to sound odd, but this was done in the old times, so you'll get this.
Yes.
When you'd have a hole in your sock.
Nothing personal again.
You'd have a hole in your sock, and then you'd darn the sock.
Right.
You'd take a piece of string, basically, and kind of weave all of that through together.
Well, actually, that's true. But that's actually more like the fishing line technique that took place too, because then somebody came up and said, "Oh, we can recreate this cruciate ligament by using 80-pound test fishing line. That's like so strong. That's what you would fish for marlins and stuff like that with." And so that happened for quite a while. And actually, the tightrope procedure uses that.
That's
same
where I was
principle.
going to ask: did they ever go on to tightropes?
Yeah. Oh, geez. Anyway, so those are all good procedures, but what we're talking about is there are options, and if you think that you are out of options, this is the show to be listening to. Again, you can email us, you can Facebook us, we're all over the place. It's Dr. Randy or Radio Pet Vet. You can find us everywhere. But that's the answer to the brace thing is. I'm very cautious about the brace. Now, post-surgically and possibly in the rehab or recovery mode, it's not a bad idea, and there are some things you can do. But, again, I think that there are much lighter weight neoprene type things that can be used just to protect the joint, and you don't have to spend $700 or $800 on a cast and a brace that's made and whatnot. So
well, what do you do if you have a pet that, let's say, a surgery was done, but that they are continuing to be mobile at a time when they shouldn't be, and maybe you can't be home with them.
Right.
So is that a time when maybe a brace is used for small amounts of time?
Yeah, you could definitely do that. That would be more an application that I would approve of because again, it's not hampering the recovery time and it's not. But generally, what most people are told after those types of surgery is strict cage rest. For sometimes up to 6 to 8 months. Now, it's really been shown by some of the better sports medicine people, and these are people that are in line with what we do at Paws Veterinary Center, that these animals should really start working that leg very, very quickly. We don't want the plate to break apart and stuff like that, so we're not overworking. But in water, for example, as soon as the sutures come out of a surgery site, which is usually about 2 weeks. We can do water therapy on these animals where we're taking 60% of the weight off their body and they're exercising their muscles and getting in warm water and it's therapeutic and it's all working well, but we can start them on that pathway and then obviously work them up over time. It's definitely there are definitely some options.
I have a pit bull, Kona,
Yes.
and she had a slight tear of her ligament in her knee, and we at one point were going to look into surgery, but really she's been doing well. She goes on her walks and once in a while she'll get a little limp. She had fallen in the pool and struggled to get out, and she seems to be doing okay though. So I'm almost happier that we didn't go with putting her through something like that until there's maybe a full tear.
Well, and even then, we've actually rehabbed animals where people don't want to go to surgery. They don't want to spend the money. They don't want to go through the aggravation. And we actually rehabbed full tear animals with ACL ruptures, and they've done great also. Again, they may have a small limp, or they may have some intermittent pain once in a while. But as a guy of 62 years of age, I have lots of small pain, and I do limp occasionally, and no one really wants to put me to sleep, I don't think, yet. So